To welcome all of you to Birchfield Ward Forum public meeting on online. First item on the agenda is basically the introduction. I'm Councillor Mahmood Hussain, and I'm a councillor of Birchfield Ward, and I'm chairing this meeting this evening. I don't know, Doctor, can you sort of introduce yourself?
Sure. So I'm Dr. Justin Ryan, I'm the Director of Public Health for Birmingham City Council.
Okay. Neil?
Good evening, everybody. My name is Neil De Costa. I work in the Neighbourhood Development and Support Unit, and I'm supporting Councillor Hussain this evening.
Yeah, Leslie?
Oh, hi, I'm Leslie Bannister. I'll be producing the meeting tonight. I've got my camera turned off at the moment.
Right. And we have Les William. Can you introduce yourself as well, please?
Yeah, thank you, Councillor. Good evening, everybody. My name is Les Williams, and I'm the operational manager that looks after your waste collection services
right.
at Street Kensington.
Okay, thank you for that. And we don't have Sergeant Sean Stanley with us this evening, do we, Leslie?
Not currently. He's trying to log on from home.
In that case, then I just go into the second item, which is a notice of recording. It's for me to advise that the virtual online meeting is being held in public, and recording will be available for public future recording. That's that. And we go into the item 3. We got an update from Dr. Justin Verney, Director of Public Health, and he's going to update us on pandemic coronavirus. So over to you, Doctor, and see what you got for us and where we are with these new, basically, restrictions and regulations and all that. If you can talk to us about that, please.
Great, thank you, Councillor, and hello, colleagues. So what I'm going to do is I'll talk a little bit about where we are with the current situation. I'll talk a bit about testing and a bit about vaccination, and then I'll finish with a bit about specifically where Birchfield is as a ward. So coronavirus appeared back in December last year, first appeared in the UK in February this year. First case in Birmingham back in the first week or so of March, and then we saw a rapid increase of cases up to really the end of May, and then case numbers started to come down. We came out of restrictions in June, and we were doing quite well in Birmingham. Testing was increasing, but we were saying roughly the same amount of tests testing positive. Then towards the end of August, things changed and we started to see case numbers increasing quite rapidly. And we went into an area of enhanced support and then national restrictions in mid-September, around the 15th of September. And since then, what we've seen is we've continued to go up, but at a much slower rate than other cities across the country. So where Liverpool or Manchester went up very quickly and ended up in tier 3 restrictions, we were going much more slowly in our tier 2. So it was really working in Birmingham. Wasn't bringing it down, but it was definitely slowing our rate of increase. We then obviously went into a national lockdown about 3 weeks ago. And what we've seen in Birmingham is that we've continued to see that increase going up, and we're just starting to see over the last day or two the first signs that we're coming over the top of the peak and coming down. But it's quite early days, and Birmingham still ranks up in the kind of top 20 or so areas across the country. And if I look at the most recent data, which I'm just having a look for you on my computer. So the most recent data, which is up to the 19th of November, and the reason it's about 6 days out of date is that ensures that all of the tests have got to the lab. We've got all of the results and they've been cleaned, so they've taken out any people that have tested, say, twice in that period. So our case rate is running at 360.9 cases per 100,000. That's slightly down, and we're now starting to see that as a statistically significant decrease from where we were in the previous 7 days, which was at 384 cases per 100,000. But we've still got quite a long way to go to get down back below the kind of 200 cases per 100,000, which government considers the kind of threshold, or at least where they're saying anything above 200 is considered very high. So we've still got a bit of a way for that. When we look at the profile and the kind of demographics, we're seeing that the highest rate of new cases now is in our, just double checking it for you, so is in our 30 to 44-year-old age group, followed by our 45 to 64-year-old age group. To give a context of that, 30 to 44-year-olds, the rate is around 449 cases per 100,000, and in our 0 to 15-year-olds, the case rate is only 223 per 100,000. So there's quite a big difference, and what we see reflected there is that we're still seeing quite a lot of cases and little clusters of cases in workplaces with spread in the workplace. When we look at the spread in terms of the ethnicity of the new cases, it's been a pretty stable picture over the last 6 weeks, with about 40 to 45% of new cases being from white communities, and in our non-white ethnic communities, the largest proportion being in our Pakistani community, which ranges from about 24 to about 27% of the new cases each week. We have seen an increasing number of outbreaks in care homes, unfortunately, and we've seen increasing size in the number of outbreaks in care homes as well, which is disappointing. So there is a bit of a shift there in terms of the picture of what's going on. So I'll move now to talk about testing and then vaccination, then I'll bring it back to Birchfield and what's going on specifically in your ward. So in terms of testing, there are now 2 types of tests, well 3 actually available. So first of all, antibody testing. That's looking at, have you got antibodies, i.e. did you have it some time ago and your body's learnt to give some defence. Now you can only get those privately. Frankly, I would say it's a bit of a waste of money. And the reason I would say it's a waste of money is that we're increasingly seeing evidence that if you caught COVID back in March, for example, you developed antibodies, it seems that after about 3 or 4 months, your body forgets how to make them. So you then test antibody negative. And we think that probably means your body can't defend itself if you catch COVID again, which is very disappointing. But it's one of the reasons that we have vaccination, that vaccines tend to teach our body how to do a better response than if we're just exposed to something naturally. So I would advise you, don't waste your money on antibody tests. I don't think it tells you anything, and it doesn't change what you have to do in terms of social distancing, washing your hands, covering your face, all of those things. The second type of test, which is the test that if you have symptoms, so a high temperature, a new persistent cough, or a loss of sense of smell or taste, any of those symptoms, ring 119 or go on the NHS website and book a COVID test. That's a PCR test. It's done with a big cotton wool bud, basically up the back of your nose and the back of your throat. You can get it through the post, at a drive-in centre or at a walk-through centre. And there's plenty of appointments to get. I had to have a test yesterday because of some healthcare reasons, and I was able to book a test the same day, and I got my result this morning. So, it's really working quite well, that test. And that test is very good at telling you, have you got COVID? What it's not very good at telling you is, are you infectious at the moment? So it's very good at finding COVID if it's in your body, but it's not very good at telling you how much COVID there is. Now, the new type of test that the government's been talking about, this lateral flow test, it works in the similar way with the big cotton wool bud up the back of your nose and the back of your throat, but you then give that to a technician. He mixes it with some liquid, puts that onto a test kit, and then reads the result within about 30 minutes. Now, the lateral flow test is very good at telling you if you're currently infectious with COVID. And that's because it works best when there's lots and lots of COVID at the back of your throat and the back of your nose. It's not very good at telling you you've got COVID if the COVID is mainly in the bottom of your lungs and there's only a little bit in the back of your throat and the back of your nose. So lateral flow is really most useful when we're trying to see, is someone infectious today, but it's not very good at telling us, have they caught COVID, but they're just not at the infectious stage yet. So that's why the two tests are slightly different, and they'll be used in slightly different ways. And we are working at the moment to set up a testing centre for lateral flow, but it will be used for people that are invited, and there'll be very specific groups that we'll be inviting for lateral flow. So that's where we are on testing at the moment. Finally, I'll talk a bit about vaccination. So as you've seen, we've now got several vaccines that have got through research trials. They're going now into the regulation phase, and that will then mean that they, once they go through that regulation, they'll be able to use them. I would expect us to see the first vaccines becoming available just before Christmas. They will be prioritised to NHS staff and to those that are most likely to die if they catch COVID. And there's a national committee that kind of looks at the evidence, and what that's saying is that the people that are over 85 and the people that are in care homes are the most vulnerable. So they'll be vaccinated first, and then it's likely that it will be based on how old you are when you get invited to be vaccinated. And we need people to have 2 doses of the vaccine so that they get protection. So it will take probably 3 to 4 months minimum before the most vulnerable people have all had their 2 doses. So I think it will take quite a while before we're out of this restriction world. So finally, before I move on to Birchfield, I know you all want to know what tier we're going into Thursday. I don't know yet. It's a national decision. They're not telling us. But as I've said at the beginning, you know, if you look at where Birmingham is, we're definitely in the top third of areas in the country. And although we're coming down, we're not as far down as I think government would like us to be. So I think it is likely we'll end up in tier 3, but we'll see what they say. They look at both the case rates in the over 60s and the hospital utilisation. So we'll see how that plays out, but I'm afraid I can't tell you today where we're going to end up on Thursday. So finally, just to close on Birchfield and the latest data for you. So looking at the week ending the 19th, or the 7 days ending the 19th of November, Birchfield has the 10th highest rate in the city. So the rate in Birchfield's 464.7 cases per 100,000, and that's come down a bit compared to the week before when it was 584.9, and that sounds like a big jump, but because Birchfield's quite a big ward, actually it's not considered statistically significant yet. You'll need to come down probably to around 300 cases per 100,000 before we were confident that you were coming down in the right direction. We have seen, you know, and just to give this in comparison, the highest rate in the city is in Lascelles. Still, Lascelles has remained pretty high throughout the outbreak, and they're running at 858, followed by Aston at 626. And the lowest rate in the city is Bawdsley and Highgate, which is running at 193 cases per 100,000. So there's quite a big span across the city. In the last 7 days up to the 19th, we've only seen two parts of the city increase, and in both of those there have been quite big outbreaks in care homes. And we've seen now, I think I'm just eyeballing it, 8 wards of the city where we've got a statistically significant reduction in cases. So we are starting to see that sign of areas coming down, but the majority of the city, when you look at the kind of confidence intervals and the bandwidth around how confident are we this is a real change, is it looks like we're at steady state yet. We haven't really made it over the hump. We're just right at the top, and we need to be coming down consistently, probably for at least 2 weeks before we'll see much relaxation. So I'm happy to take any questions that you might have, Councillor, or anyone for the Ward Forum would like to ask.
Councillor saying, can you pop your camera on?
I have, yes, I have put my camera up, yes. I don't know whether anybody wants to ask you a question, Doctor, or not. Is there anybody who wants to ask a question?
I've just checked the Q&A, Councillor Hussain. There isn't, or there aren't any questions as yet, but you may have your own.
Well, I just wanted to ask one question, Doctor. If you know, you basically said that you know where the Lascelles and Birchfield were basically they're in high in this increase, right? One thing that I noticed, you know, all the mosques in Lascelles or in the Birmingham have been shut down for praise, right? But the children who goes for religious education, they are allowed to go in, right? Now, I mean, children get mixed with each other as well as the elderly people. So don't you see that that could be a risk for people to spread this virus amongst them? Or the other thing is that, you know, when we did have these congregations at these mosques, you know, and people were coming out, you know, they were asked to wear masks and everything. But when they were coming out, they were mingling around amongst themselves. I think a strong message should go to the organizer of these mosques, making sure that people, when they go into these mosques or churches or gurdwaras or wherever, when they come out, they should not get mixed with each other.
Yeah, so I mean, I'll take the mosque one first, and then I'll come back to the kind of educational side. So throughout the outbreak, we've been working closely with the mosques. I have a meeting with them every 2 weeks, and then the week in between we have an interfaith meeting, and that's an open meeting that all the mosque leaders are invited to, and we work with them closely as the regulations have changed. But you're right, it is for the mosque to manage, and one of the really important messages is, you know, even if you're really good at the physical spacing when you're at prayer, it's just as important you keep it up when you walk out into the car park, and that's not the time to go shaking hands with people, because that's how you spread the virus. And you know, many of the mosques have been really good at reinforcing that. And before we came into national lockdown, where Friday prayer was still happening, the mosques were still holding services like the churches, the temples and the gurdwaras, we weren't seeing any evidence of transmission in those settings, which is because the mosque were doing such a good job. So, yeah, you know, I think that's a really good thing. In terms of what's happened over the last couple of weeks, there has been exemption that's allowed education and childcare provision. So mosques where they're providing faith education and that enables people to go to work, parents to go to work or to study, those children have still been able to go. And that's the same as out of school clubs and night classes, those kind of things. The reason there was an exemption for children in this way is that, one, children are not that good at giving it to each other. So we haven't seen very large numbers of children catch it all off each other. And then also that actually where they are in managed spaces, so where they are sitting doing Quran class, for example, and they're all sitting in the right spots, you know, they behave, they don't spread it. It's when they go in playtime that it becomes a bigger risk. So that's why education and that kind of provision's been allowed to continue. That being said, it's a really important point about intergenerational families. So, you know, the risk to granny and granddad if they live with you and your child gets it is a risk. And that's why it's really important that we encourage all families to look up germdefence.org. That's germdefence.org. It's a website. It's available in over 60 different languages, and it takes you through how to stop the spread of COVID at home. So it's specifically designed to what can we do at home to reduce the risk, particularly if we've got vulnerable elderly people living with us. And it's got some really sensible things in it, like staggering meal times. You know, one of the ways to protect your elderly relatives, is not to have everyone sit down to eat dinner together, because that's a really good space for the virus to spread. You know, you pass the chutney or the salt and you're passing COVID with it. You know, so actually letting them have their dinner first and then everyone else eating together is a much safer way. You know, Granny's got a favourite TV show. Let her watch it in peace and everyone else goes and does something in a different room. Because again, sitting around and watching TV together is a good way the virus spreads. So lots of simple things on germdefence.org that can help. And it's really what we do at home that protects the people at home most. So it's a really important point, something we've all got to be really conscious of, particularly with the bubbles over Christmas. You know, we want everyone to see many more Christmases, you know, and I would trade in one Christmas for another 10. So, you know, do think carefully about how you're going to bubble for the Christmas week, and please protect the people you love and care about, because you're most likely to catch COVID from someone you know.
Okay, thank you for that, Doctor. Is there anyone who wants to ask a question before I move on and thank the doctor?
No, Councillor Sain, there are no further questions.
Doctor, can I thank you for updating us? It's very useful, and I'm very grateful to you for spending some time for us. Thank you.
Thank you very much.
Have a nice
Thank you.
Yes,
All the best. Good night.
Can I move on to next item, which is from the fleet and waste management? We have with us this evening Les William. Les, can you tell us what's happening with this thing and all this rubbish, which is on the increase since we got this COVID-19? So it's over to you, and see, you know, just looking forward to hear from you, you know, situation in my particular ward.
Okay, thanks for that, Councillor. Unfortunately, I didn't quite get the middle part of that question.
I said that, you know, where we are with this fly tipping and all this dump rubbish, because I feel that since we got this COVID-19 from March, we are on increase, right? The dumping rubbish is basically, fly tipping is very highly increased in some part of my ward. So I'm just wanted to know what arrangements you got to clear those, you know, hotspots and all that.
Yeah, thanks for that, Councillor. Yeah, we have had a number of issues since the first lockdown, and fly tipping has increased. It's not just across your ward or Birchfield or across Birmingham. It's a countrywide, should we say, a different epidemic or pandemic. Fly tipping across Britain has increased in the recent months. It has plateaued and it's started to reduce to a degree now. I can say I've looked at the data against Birchfield ward, which is one of our bigger wards, and we're currently showing around about 620 cases of dumping across the ward. That's not by far the best. We've got wards with much less. We're in the top quartile, but compared to another ward which has got 1,800 instances, we're about a third the amount. But 620, as I'm looking at it, is still too many for what we'd like. Now, obviously, the pandemic has caused us a couple of issues, and a lot of it is down to people stopping at home like they were asked to do. And we thank you for that, because it's allowed us to do our job. But what it's also allowed residents to do is to have tidy-ups in the sheds, in the garages, in the lofts, and it's generating more waste for us. There is obviously the opportunity for people to go to take it to the sites, to tip it at Perry Bar. But unfortunately, some people don't realise or don't know that, and it's put out, it's classed then as dumping. And we are actively going around picking up what we can as soon as we can, which has increased, as I say, but it is coming down. We'd like to have it a lot lower than what it is currently, and we're engaging in the regular spots, trying to get our waste enforcement team involved, where we can get some proof so we know who's actually dumped the rubbish out. But what my plea to residents would be, if you see someone doing it, please tell us, please come forward and tell us, because we want to prosecute, and all the information that we can get to do so, will come from residents. Obviously, lots of dumping goes on at night where we're not out with the with working, etc. And we might see a car pull up and dump some rubbish on the side of the road. If we get that registration, please come forward to us, because we will follow that through and we will issue fines for anyone that is caught dumping. But even on the daytime, if we see it, please report it to us. And if you've got a witness, or if you've witnessed it happening, it goes no end of help to us, because we will prosecute in every instance when we've got the information and the witness statement to show what has been seen. A couple of other updates for you, Councillor. One around miscollections. Oh, sorry, before I go on to miscollections, what I should also add, with people stopping at home, which they have been doing since March, obviously people are not working, they're working from home, etc. That is generating more waste. We have seen an increase in the waste being presented and a decrease in businesses' waste being presented, and it's because people are working from home. So we are aware of that and we're tackling that. It has increased our workload to a degree, but to date, I would feel that the service has gone above and beyond. We've got very few drop roads. We will have them, we always will do, for various reasons, like vehicle breakdowns and staff shortages. But since March, we've been performing really, really well as a department, and we've kept most collections up to date. We do have some miscollections in the ward, and again, by far not the best across the city. We balance our miscollections per 100,000, and we expect our benchmark to be about 100 per 100,000. I can say your recycling currently is running at 80 per 100,000, so we're below the benchmark that we've set ourselves to achieve. The residual miscollections currently 110, so it's just over the amount. But I will say, as a ward, it performs really, really well on miscollections. So 80 and 110 might sound a lot, but it is really good. We don't shout from the rooftops about that, which we should do more often. But the miscollections are better than what we'd expect. We are taking some steps as we speak as well. So part of our structure and our moving forward, we've ordered a number of new vehicles. Now the new vehicles, which I'm told we got one coming in this week. One might not sound a lot, but they come in bits and drabs because we have to get them ready to go out into service. We've got about 50 or just under 50 on order, which will come in between now and early May. We're going to get one this week, and then it's going to be 2 to 3 a week. Obviously, they're going to be shared out across the city, and we're replacing some of our old worn-out fleets. Some of our miscollections and our drop work is because of the old worn-out fleet. So these new vehicles will improve our performance even more. We've also took the step with our new vehicles now is we're not buying the great big trucks that you're used to seeing on the streets. Because of the amount of cars in Birmingham now, and everybody seems to have a car, we're finding it difficult to get into roads and revert into little cul-de-sacs. So we're buying more of our smaller type vehicle, the alley cat type, which can get into the confined spaces. And for the bigger vehicles, we're buying what we call narrow track. And a narrow track vehicle it's the same size in length and height, but it's narrower in width. It's got a slightly smaller payload, but it's able to get through the roads that are considerably parked up. So that will enable us to get into the really tight roads, so we can collect the waste and not have to report it as dropped through parking issues, etc. The last update I've got for you is around leaf fall and leaf clearing. Earlier on this year, we managed to get some more funding back into our budgets to account for leaf fall. And mid-October, we started some leaf fall crews off. So the budget has accounted for us to take crews on to clear the leaves, which we haven't had now for probably about 6 or 7 years. Now then crews are working across the city. Pettybar, who services your ward, they've got 3 crews, and what they're out doing now, they're out working across all the wards from Pettybar. Managers have triaged the worst wards. So if you've got a ward with lots and lots of trees that are continually blocking the drains and that, the managers are now sending them crews to work through them kind of wards. If you've got a ward with a lot lesser trees, they will come a bit further down the pecking order. So we know we've got issues on certain ones of our wards. The managers, you'll know Justin, the manager at the depot, quite well. He knows his wards very, very well, and he'll be allocating the workforce to where they need to go. So if we've got a big leaf fall in a road or a given area, and let's say it's prone to flooding, we will get out there first to try and avoid any flooding, etc. If you have any jobs that, any residents that come to you that have got real problems with leaves, let us know and we'll try and give you an idea of when we're going to be visiting. So that's all from me as an update, but if you got any other questions, I'm quite happy.
Any question from anyone? Neil, does anybody want to ask a question?
No, we just checking, Les. No, we don't have any waste management questions as yet.
Les, I do appreciate the work your depot is doing. From Perry Bar, in particular. I think in these very difficult circumstances, they're doing a grand job. Right? I'm not complaining about it. But one of the things, which I want to raise, and I did raise that at one of the meeting where you present about the leaf falling, and clearing the leaves and all that. And I think you have answered that. What I want to say to you, it's general street cleansing in the ward. If you walk around in the ward, what you will see that there's a lot of litter, a lot of broken glass, and all sorts of rubbish is lying about. The roads are really filthy. Do we have a regular beat sweeper who goes around and sweep these roads or not? Now, because you see, I have residents coming to me and saying to me that the council, we feel that the resources have been taken out of Birchfield and they have been used elsewhere. I know that is not the case, but how I'm going to convince those people, when they see all these filthy and dirty streets?
Okay, so probably an answer to that, Councillor, is obviously we've got our work schedules. They do waver a bit this time of year because although we got leafing crews, we do get the crews, the normal ward crews, to tackle the leaves as well, because they offer so many problems for us with flooding and with people slipping and just general mess on the street. Everybody seems to pull their hand to the pump to clear up the leaves this time of year. I can assure you that I can't tell you off the top of my head what resource you've got, but nothing's been taken out of Birchfield to move into another ward. I'm quite happy if you want me to get the maps of what we do and the schedules and to tell you what you've got exactly in your ward and when they're working. Again, the schedules are a bit haywire at the moment because of the leaf fall, but you'll be able to say, we'll look at it and understand when we're working in the ward and what areas. But if you've got an area which is you think's quite grubby, shall we say, drop me a note on it and I'll have a clear up. We can divert some of your ward resource to do that. The ward crews should know where their bad spots are. I can't really comment on every resource because I would always ask for more. The more people we've got, the better job we can do. But we're moving along that line further down the track. At the moment, we're just doing the best we possibly can with the resource we've got. And it's not always easy, and I'm sure you appreciate that. But if you do have any real problems, come to me or come to Justin. We will put steps in place.
No, thank you for that. I mean, I got no problem, coming to you or Justin. You've been fantastic, as far as I'm concerned. Every time I pass anything on to you, it gets done, and it's good. But it's just that perception I'm worrying about from people. You see, also, these you talked about these clearing leaves and all that. At one time, some years back, I know there has been cuts in the budget and all that, but they used to clear these leaves as they were falling. Now what they do, when I spoke to Justin the other day, anybody said to me that the last time they were here in Birchfield was in August, Now we in November now, right, end of November. It's been 3 months, and during these 3 months, you know, more sort of leaves has fallen, and you know, and they're turning into mud, and they're slippery, and they're also, you know, it's really dirty, you know, or there, Les. You know, what I really want to see, you know, if some sort of mechanical sweeper or something going into the gutters, you know, or taking these leaves away, because you know, if an elderly person wanted to have a walk around, you know, and they could very easily fall and slip over, you know, these leaves, you know, because they're very slippery, you know, and that's why I'm just making my point, you know, asking you if there's a possibility, you know, to have it a good sweep up. Yeah,
I'll take that back to Justin, and I'll see what we can do. And if it's all right by you, Kaz, I'll drop you a note with our plans.
Thank you.
But what I will say that normally when this year we couldn't predict this year. It's been so strange, COVID, all the rest of it. Even the leaf fall this year has been different, because normally we gear up mid-October, the leaves start falling up. Well, early October we geared up. We had really quite a mild and late summer, and what happened about a month ago, the weather suddenly changed, and where we would see the broadleaves fall, like your chestnut trees and that, we would be on top of that. We'd be, you know, in front and doing them areas first. But the weather changed almost overnight. It was over a weekend, and a whole lot fell in 1 week, and it's left us sort of reeling backwards a little bit, because it's not how we've always done leaves. It's usually the broadleaves fall, and at the end you get things like the oak trees and the hardwood trees. The whole lot fell at the same time, and I live in Birmingham myself, and outside my garden as we speak, it's all mushed up leaves in the channels, and I completely understand why, because it just all fell in one place, but sorry, in one time. But let me take it back to Justin. Let's see what we can do for.
Thank you, Les. Thank you, Les. Is there anyone else who wants to ask a question or not? No? Les, with this, can I thank you, you know, spending time out and coming and talking to us this evening. Thank you very much. And I thank you for doing all this great work you're doing. Thank you.
Thanks for the good words, Councillor. And please, next meeting, feel free to invite me. I'm always available to attend.
Okay, thanks.
Yeah,
thank
you.
You. You have a nice
everybody.
Now, yes.
Take care. All the best, Les. Cheers.
Neil, we haven't got the police with us this evening, have we?
No, we haven't, Councillor Hussain. Sergeant Stanley has emailed an update though. So
who's got that update?
Yeah, he's emailed an update.
Yeah,
so,
I haven't got his update.
Okay, it's only been emailed tonight. Yeah, so if you like, I can read that for you, or
yeah, just a sec. Yeah, police update. Yeah. Yeah, it says basically, I apologize, I can't be there online. I am at home and I am having a great difficulty logging in. If there are any questions for me and my team, please pass them on to one of the hosts, and I will do my best to answer in due course. I hope you are all safe and well, and that I hope that we will at some point get to meet again in person at the ward forum meetings. It seems a while now since I last attended. COVID-19 has had a massive impact on all our lives and will continue to do so for foreseeable future. Please adhere to the laws and guidance relating to our current lockdown, and we all need to play our part in order for these restrictions to ease, but more importantly to keep ourselves and our loved ones safe from this deadly virus. If you are aware of any COVID-19 breaches within the neighborhood, please report them by calling 101 via web chat using the West Midland Police website, so that we can address the issue as soon as possible. That's his update, Neil. I don't think we got any residents with us.
There are residents logging in, Councillor Hussain, and some have had problems logging on.
I got emails here. I got an email from Igla. She's having a difficulty joining the meeting.
Right.
Michael Tai, I think he's having a difficulty joining the meeting. And I think we need to look at this. If these residents can't join the meeting, then I think there's no point we meeting, because otherwise we're just going to be talking to ourselves rather than.
I understand, Councillor Hussain, and I have sent them links while you've been live. Just to update you that there was some more information within Sergeant Stanley's email, so I'm not sure whether you got a shorter version. I don't know whether you want me to.
Yeah, if you want to do that, yeah.
Okay, so the rest of that email was, or is, you may be aware that during the summer, Operation Reliance was running in order to tackle unlicensed music events, commonly known as illegal raves or stack parties, due to the negative impact these events have had on our communities, not just in an antisocial manner, but also putting attendees and anyone in the vicinity at risk of COVID-19. This operation is currently still ongoing and will continue to address any of the events taking place. Again, I reiterate, if you are aware of any such events taking place, either now or you are aware of any event that is going to take place, please make sure West Midlands Police know about it so we can act on your information and keep the community safe. There have been a spate of burglaries across the ward and neighbouring wards in recent weeks. We have arrested 2 males and both have been charged with a number of burglary offences, and they are due back in court next month for trial. Both are currently on remand. This does not appear to have stemmed the number of burglaries in the area, which is fantastic news. I do apologise. This does appear to have stemmed the number of burglaries in the area, which is fantastic news. As the darker nights are already upon us, please ensure that we are locking our doors and windows and are making your home secure to deter any would-be criminals. If you require any further advice about this, please email lozelles@westmidlands-mid. I'll say that again, at lozelles-west-midlands@pnn.police.uk. I'll also put that in the meeting chat. Please do not use this email to report crime and instead go through the proper channels. Multi-occupied houses, or HMOs as they are commonly known, are a concern to local residents and are difficult for the police to resolve alone. We have begun joint working with Birmingham City Council HMO licensing, whereby we already attended a number of premises in the area conducting safety checks and housing checks. A number of actions have now come from those visits that landlord/management companies are being required to take positive action. We have also been working with management companies of certain premises where issues have been identified. This work is ongoing and we hope to make continuous improvements. We have executed a number of warrants in the area and will continue to do so, including one at a supermarket on Birchfield Road, whereby 4 males were arrested and a quantity of drugs were seized. That investigation is ongoing. Most of our warrants are only possible as a result of the community intelligence that we receive and can act on. If you see anything suspicious in your area, please call us in confidence. Alternatively, you can call Crime Stoppers and the information will come to us for review. We have had a small number of theft from motor vehicles in the area, mainly due to owners not locking their vehicles. The offenders are randomly trying car doors to see if they're open and insecure. If they are, anything of value is stolen from inside. Please always check that your doors are locked and don't leave valuables inside your vehicles. On this, we have recently arrested 2 female suspects responsible for such offences. One offender has received a 9-month jail term last week. The other female is yet to be sentenced, and the team have been working on a criminal behaviour order, which, if successful, will mean she is prohibited from entering the area. As I have already mentioned, I hope that we can meet again soon in person and have the ward forum meetings running as they used to. In the meantime, please keep yourselves and your families safe. Please, Sergeant Stanley.
I didn't have that version of emailed you for some reason.
That's fine, Councillor Hussain. I just checked because I thought you might have had a shortened version, so hopefully that will be helpful to the public.
Yeah, okay, all right. You know, again, I'm going to say that we need to do something, you know, to get these people join the meeting. If we're going to have these meetings on a sort of regular basis,